Mr. Speaker, we think it is absolutely despicable that our government is stealing people's money and unfairly distributing them to those who can least afford it. Sorry, those who can afford otherwise but choose not to. We think it is incredibly unfortunate we can't stand behind a solution or a system that disadvantages low ACS people, that disadvantages rural citizens whilst benefiting rich people who can afford private schools, private health insurance, and other services that they should be paying for themselves. We support a system in which all Australians and all citizens can benefit from the services that government provides or be able to provide for their own services. And we see that the waste that exists in the current system and the low quality of services provided in the current system can be solved really easily by adopting our model. And this is why we think that people should be able to opt out of public services in return for tax breaks. So before I go into my point, I want to explain what this model looks like in the world we want to tell you about. So we think that people should be able to opt out of services such as health, services such as education, and other basic limited infrastructure services. So we think that this looks like people paying reduced taxes for certain services, people not having to pay their Medicare levy if they want to opt out of Medicare, people having to pay for toll roads if they want to use services like that. And we think that the best way to measure these forms of tax breaks, no thank you, the best form to measure these forms of tax breaks is make them proportional to the amount that the government would have otherwise spent on these services using that tax money.
On that point.
No, thank you. If anything, we think that in certain circumstances, we would rather this be underestimated than overestimated, because we don't think that would be like a massive incentive for people to change whether or not they opt out of the system.
Point.
No, thank you. So we want to clarify that the system doesn't look like people not paying taxes because they want to pull out of services. We think there's still like a certain amount of services that are really hard to opt out of. But broadly, we think that it looks like tax breaks, it looks like a reduction in taxes, not paying for things like Medicare levy.
Point.
No, thank you. So I'm going to bring you 2 points of substantive. Why people have a right to opt out of these kind of services under our model. And secondly, why this improves public service and improves the quality of public service provided. At Deputy Prime Minister, we will tell you why this leads to better services provided in the private sector and why this improves the quality of services received by rural people and rural citizens.
Point.
No, thank you. And that's my first point about why individuals have a right to opt out of the current system and adopt our model. As we think on the most basic level, people know best about their own needs, their own health, their own education, their own infrastructure needs, and their own services that they require to fulfill their life. No, thank you. We think that the government doesn't know everything about the citizens, the need of the citizens, so we think on this basic level, individuals know more about what kind of services they should receive and what they should be paid for those services.
Point.
I'll take you, Chris.
Rich people pay more than they get back in tax at the moment, so they have an incentive to opt out. That means the poorest will get even lower quality services, doesn't it?
We disagree with that proposal because we think that under our system, there will be more funds, there will be more resources to be distributed to these people who need that kind of money the most. We think that under our model, this money can be used more effectively to the smaller number of people who need these services more, and it can be better used to ensure that these citizens receive a high quality of services, and those who opt out of the system will receive a higher quality of service as well. So secondly, we think that people who don't benefit from the system and these services shouldn't have to pay for them. And we think that under this system where the government takes people's money and redistributes it to people in a way that doesn't really address the needs of individuals and what those individuals can afford is a really damaging system. We think that we believe in a principle where the individual knows what they need, the individual knows their basic requirements of society, and that they should be able to pay for them in whatever way they want to. We think this user pay system where people pay for the exact services they receive, and if they can't afford those services, the government provides those services and intervenes to ensure that they do receive the quality of services that they deserve as citizens. No, thank you. Now to my second point in this debate, about why this will improve the quality of public services provided to citizens. So we think on one level, people who can afford these services will get off these services because they can afford a better form of private insurance or a better form of private education that the government service can't currently provide because it doesn't have the resources to provide those services because it's flooded with a number of people wanting these services. So we think that under our model, under our system, people will get off these services because they know they'll have a better quality access, better services provided to them in terms of education, health, and other forms. What this means is that there are less people demanding these services. There will be more money and there will be better specialisation for the government to provide these services for the remaining people who can't afford to get onto different services. What this means is that there is more money, more resources directed at fewer people demanding these services, which means that the per capita or per person amount of resources being able to be spent on these services improves. So this improves the quality of services for people who are most vulnerable. For those people who can't afford to go on alternative services because they don't have the wealth to afford things like private education and private health insurance, what this system does is ensures that these individuals still have a high quality access to high quality services provided by the government. Secondly, we think that it provides the government an incentive to run better services so people don't opt out of these services. So we think that under these circumstances, the government has an incentive to raise money to provide better services, to maintain popular support to provide these things to citizens. Secondly, we think that if people believe that the services they get when they opt out, the services they don't get, the services they have currently are better than the services they get when they opt out, we think that in these circumstances, people won't opt out because the services they're receiving are of a high enough quality. So we think that government providing this incentive to people by improving services because they want to have money, because they want to maintain their popular support, we think it's a large incentive for the government to ensure that as many people as possible stay on these services, and in that system, they get as much money as possible, which is why the government has an incentive to provide the best possible services it can. So ultimately, because we think that people have a right to opt out of the system, because we think this improves the quality of services provided to individuals and citizens, we believe that people should be able to opt out of public services in return for tax breaks. Thank you.
On our side of the house, we believe that people already opt out of public services, and we think that they should. We don't think that opting out of public services means that they don't have to pay for them. This is because we think it's people get a lot of benefit from public services they don't necessarily use. We think it results in a better educated, a healthier workforce, and we think that on our side of the house we're always happy to stand by people being generally better off under the public system. So, several points of rebuttal firstly. Why services are actually worse off under this model in terms of the public and private sector. Looking at the public sector, we think that under this model, services will be targeted to the rich to get them to opt into that system, to get their tax dollars, to make sure that they're paying for that public system. We think what you end up with is a public system that then caters towards that middle class and upper class who might opt out anyway, and that public system is then no longer able to cater for those that have to use the public system, those that aren't able to opt out, and maybe have to suffer under a public service that doesn't necessarily cater for them and what they need. Secondly, we think that the Prime Minister said that public services were already considered bad and that's why people opt out. We think they're only going to be worse under your side of the house because maybe in the short term, having less people in the public system is a good thing because maybe then there'll be more hospital beds. We think what this means in the long term is that there'll be no money, no tax dollars going into that public health system, which means that there'll be no room for infrastructure to grow. There'll be no money for that public service to then get better. As the population grows in the long term, as maybe more people need to go in the public service, there'll be no money to improve those services and make them better in the long term for people that can't opt out. We think that is only a situation on your side of the house. No, thank you. We think that's really bad. We're not prepared to stand for that. Secondly, the Prime Minister wanted to talk about where the government will get their money from to make these services better. In the real world, people pay for these public services, such as Medicaid, the public health system, and then opt out and go into the private healthcare system. And we think that's fine, because that excess money that they've paid for, no thank you, to go to Medicare, is the money that is then able to support those people who can't necessarily pay for the public healthcare system but can't opt out into anything else. We think when that is where the majority of funding towards those public healthcare systems are going, is from that excess, that wastage that the Prime Minister wanted to call it. Like, you're not going to get money from anywhere else. We think that all you end up doing is making the public healthcare system worse off because there's less money. Okay, now on to my substantive points. Firstly, why you have an obligation to pay for things you don't use directly, and why this will actually benefit you in the long term. Secondly, why some people can't necessarily opt out of some services. And thirdly, the harms to public services in the future. Firstly, why people have an obligation to pay for things they don't directly use. We think that people as citizens, firstly, have an obligation, in paying taxes to support people that can't necessarily support themselves due to structural barriers that potentially limit their social mobility. We think because people benefit from these public services, even if they don't use them, such as the public healthcare system, where people under that system can then be better, healthier workers for a company, for example, or in the public education system, where you'll get better, more productive, more educated workers in the future. You probably mitigate the chances of those children going into poverty. That's better off for those children and those people in the public healthcare system. We think that it is an obligation, and I'll take you in a moment, we think it is an obligation for citizens of a state to provide for those people who can't provide for themselves, yes.
Don't you think that people opting out of the current system and going to things like private healthcare, private education is a form of them using their social mobility to receive better services for themselves?
I don't think so, because I think in the long term, it's really harmful for people to opt out of these public healthcare systems, because there'll be no ability for that system to ever get better in the long term. There'll be no funds for that, and we think that that is actually going to be more detrimental to those people who have limited social mobility, because now not only do they have limited social mobility, in and of itself, that the public healthcare or public education system that they can't opt out of is actually worse for them and worsening their condition. My second point, why some people can't necessarily opt out of some services. We think it's quite a short-term calculus to make, and that often people can't make, where they have to balance up the short-term benefit of maybe saving some or getting some sort of tax break at the end of the next financial year, versus the uncertainty of maybe not having a public service down the road that they might actually need. And we didn't hear anything from their side of the house about how people could re-opt in, to public services that they decide in the future that maybe they really need. We think it's really harmful for people who potentially opt out of public healthcare, and then mid-heart attack realise that they need an ambulance but can't get one because they've opted out of the public healthcare system a couple of years before. We think it is very dangerous for their side of the house, to make this short-term calculus and dangle this carrot of a tax break in front of them when they may not, when they don't really have an idea of what they'll need in the future. On to my last point. Why this harms the public services? Yes, Charlotte.
Do private services generally run more efficiently and better than public services?
We think that even if they do, people still have an obligation to do whatever they can, whether that is taxes, whether it is opting into that system, to make the public healthcare system better. We don't think necessarily that all private systems work better than the public system, and that's because a lot of the time, a lot of money is directed into these public services to make them better. Also, just generally more people in a system means that you can get more specialised, more varied services. We think that's a really good thing that you only get on our side of the house. So very quickly, my last point. Like I said in a point of rebuttal to the Prime Minister, the problem with this model is that in the short term, the infrastructure has the capacity, and maybe even is better, to support fewer people in this system. But in the long term, there is less money in the system and fewer people after maybe the rich or the middle class opt out. With population growing, the lack of money in the form of income tax or payments to this public healthcare system thus reduces the ability of public services to invest in future infrastructure. That if there is a population growth, then there'll be no money to buy hospital beds for more people in the future. We think this is most harmful to the people that are stuck in this public system, that can't opt out, that can't just go to something that they consider better because of some structural barriers. We think that the biggest harms to the public services actually occur under their side of the house, because it prevents them from getting better, and it is the most detrimental to people who have no alternative. We think dangling this short-term calculus in front of people when we have an obligation to provide for future public services, as I outlined in my first point, It's very harmful and harms the most vulnerable and poor in the long term. For those reasons, proud to oppose.
Sector generally does a much better job with giving better services, being more cost affordable, and making a better system for all. I will address this later, but first some rebuttal. I have three main questions. One, whether this system increases or decreases social mobility and whether that's a good thing. Whether things will get better in the long term and whether there'll be money in the system for later. And thirdly being what happens when people opt out of the system and whether they can opt back in. So moving on to my first point, with social mobility, the opposition came out with this idea that we are excluding people from this sort of better system, and that because of that they will get worse sort of public services, and as a result they'll be stuck there at the bottom forever. However, we feel like this will actually improve their social mobility, especially for people on the cusp as a specific stakeholder. If you're wanting to send your kid to private school but you just can't because it's just a little bit out of your, a little bit out of your sort of budget, you can end up actually sending them with the benefit of this tax break. As well as with increased competition within the private sector, because there are more people opting into going into the private sector, costs will be lower, so allowing these people on the cusp to opt into, better and private schools and private services. Moving on to my second question, whether things will get better in the long term. To that we have two sort of responses. One, saying that privatisation generally is a good thing and it's a lot better for everyone, especially as I will address later as to why it lowers costs and why it's becomes more accessible to more people. We believe that this is generally an outcome that society does indeed want. The second thing being that there will still be money in the tax system. We are not saying that just because you're not sending, that you're just sending your kid to private school, now you don't have to pay any tax. There's still going to be there's still going to be money to divert to public services. And because we have less people, we can somewhat specialize to the people that are in the lower SES backgrounds and have this sort of need for better public services. As Anish, as my first speaker brought out, and how I will further reiterate in my speech. Moving on to my third point, what will happen when people opt out? So we believe that people are generally rational and that they're not going to opt out and spend a wonderful tax break on a holiday or something. They're definitely going to, instead of opting out of public health services, they will get private health insurance. That way, as the opposition brought out, if they are suddenly having a heart attack, they do have private insurance with which to deal with it. However, if that is a further concern, it's quite easy to adopt into a model where you have to ensure that people have to take have to have private insurance before they can opt out to show that they are willing to do this. So moving on to my 2 points,
Given that you recognise that some people who would otherwise be giving money to these systems are opting out, the overall funding for these public services will go down. How do you say then the quality of those services will stay the same or even increase?
Well, I think that we can say that for two reasons. One, because we still are going to have tax dollars that from other sort of tax incomes, as well as the second thing being there's less people in the system, and that's all over better for the system. As my first speaker brought up, that the system can become a bit more specialized and it can work better in dealing with the problems of those people. And in that way, the infrastructure will get better, or at least more specialized, while privatization continues to improve the sort of standards that other people may not have gotten because public services are so widely used. So moving on to my first point, I'm going to have 2 points. So one being that private services are a good thing, and why having a private system in our model is overall better. And my second point being that how it's going to affect regional stakeholders and whether that's and how that is good. So firstly, privatization is generally a good thing. Most people will admit that. We believe that... We believe that more people will be wanting to opt into a private system, and as a result there's going to be more competition, more demand within that private system. So that's going to have two things. A, it's going to lower the cost, and therefore, yes.
How many people on a below median income can afford private services?
I can't exactly quote out statistics for you, but I believe that there are definitely some stakeholders who are definitely on the cusp, and having a tax break would definitely allow them to get private services, as well as under our model, well, the more people that are wanting private services, the better the private services will get and the more cost affordable they will get. I will explain that just right now if you really want. So the idea is that there's going to be more competition because there's going to be more people opting in, so there's going to be more profits in that sort of area, and so private companies are going to be more inclined to get into that industry and sort of be more competitive. Sorry. So in doing that, they're going to have two things. They're going to lower the cost because as a result, like privatization, there's more incentive in a private company to lower costs and be efficient, and because like they are essentially profit driven. As it stands, public services aren't profit driven, and then there's no sort of incentive for them to sort of lower costs and become better. The second thing is that there's going to be better privatization. They're going to cater for the needs of more people because there's going to be sort of an incentive to capture a market, and in doing that, you're going to make sure that you include more sort of a wider market spread. And in doing that, you're going to make private services more accessible for everyone. Just quickly moving on to my regional point, because it's we're allowing certain people to opt out, this means that regional people have two options. Either A, they can opt out if their services are not being provided within their area, which is currently a huge issue, as there aren't very many public services provided in regional backgrounds. But as well, if more people in a sort of metro area opt out, the government then can realise that the people paying taxes are the people in the regional area, and then provide better quality education, health services to the people in a regional area. And for that reason, we are proud to support the motion. Thank you.
Honourable Speaker, on our side of the House, what we tell you is that under the current system, people opt out anyway, and that it's okay for people to opt out, but what it isn't okay, Madam Mr. Speaker, what it isn't okay for these people to do is to opt out and then not pay for what they've opted out of, because what this leads to will be a lower quality of public service overall, and we think this is something incredibly damaging, incredibly harmful for society as a whole. I have 4 points in rebuttal and then 2 points in substantive, which I'll try and get through very quickly. First, we were told that people have a right to opt out by the Prime Minister, but what my Leader of the Opposition told you is that people currently do opt out, and we support that right to opt out, but what under our side of the House we don't support is the fact that people then don't have to pay for opting out of these things. We tell you that people must pay because overall, what people benefit from paying for things that they don't use. People will benefit just because we may send our children to a private school, we still need to pay for public education because in the long term, having a more educated workforce, having a healthier workforce by paying your Medicare levy, what this leads to is a better outcome for society overall for people who might not necessarily use these services. We tell you that, I'll take you in a moment, we tell you that these people will benefit overall in the long term. So we tell you that the right to opt out is okay, but people still must be paying. I'll take you now.
Do you think that under the current system where people opt out of these services and still receive a lot of government funding like in private schools is better than our model where people who opt out of these systems will have to pay for themselves?
We tell you absolutely yes, this is better under our model because what this means is that people will still be receiving the funding, we'll still have a lot of funding there for public services that are going to be provided, where under your model this funding reduces, and even though some people might benefit a little bit more in the private system, we actually will still have the money, we still will have the funding for the public system, which under your model reduces, which we think is incredibly harmful. On to my second point of rebuttal. We were told that better public services would be provided if we privatise these industries. We were told that there's an incentive for the government to run better services so people don't opt out. But what we tell you is that privatisation is not a good thing in this situation. We tell that it's incredibly limiting and that people don't always have a right to opt out of basic goods and services. No thank you. Because what happens when we start privatising things, Honourable Speaker, is that this isn't good for the public. It is good for the market. It is self-serving, and when we are seeing large-scale sorts of services like healthcare, like education, what we tell you is that these are things that the government needs to run. These are things that are run more efficiently, these are things that are run better when the government is involved than when the private system is involved. Because what happens is that the private system will cater to the market, I'll take you in a moment, and not the people. We tell you this is incredibly harmful because when private systems run at a loss, people aren't taken into account, but when the public system runs at a loss, this is something that's okay and something that's sustainable.
Governments are often really bad at updating to modern times, e.g. Australia Post. Don't you think it'd be a good thing if we could all just kind of shut down Australia Post by all just refusing to buy into that service and force the government to modernise?
We tell you that no, we don't think that's a good thing, because even though Australia Post might often not run as efficiently as it can, we tell you this is a service that works and is efficient and works for the people. And in these situations, we're talking about education, we're talking about healthcare, it's incredibly important for the government to do this. The private market will make it more harmful overall. And this is something that we can't stand for on our side of the house. We then show that opting out will lead to people spending money. We were told by the member for the government that when people opt out, what this will mean is that the tax breaks that they would have otherwise be paying for will lead to people spending money on things like better healthcare and private healthcare. But what we tell you is that the money won't actually be directed there, so the money involved in that system overall will absolutely decrease, because what these people will be treating this money as is like a tax break. They will be sending it on holidays overseas, they will be sending it elsewhere, and the money available for like the public system and the private system, no thank you, will decrease overall, and we think this is incredibly, incredibly harmful. So onto my point of why this will make the system worse overall. What we tell you first is that when we reduce the amount of people involved in the public system, when we allow people to opt out of the system and it becomes smaller, we tell you this is incredibly harmful, because what it means is that people won't be able to demand specialisation in that service, in that industry. We tell you that people won't be able to have the amount of resources, have those things sorts of tailored to them. No, thank you. When we see people, the amount of people kind of opting out of that system, because people just, what will happen is that the kind of lowest common denominator, if you will just be catered for. We won't see this kind of specialisation, and we won't see these kind of opportunities. No, thank you for everyone in that system. We also tell you that it will make the system worse, because what happens is that we encourage the system to be targeted to the rich. We tell you that the government will be aiming these, trying to get the rich to stay in the system, to kind of pay for the private healthcare, public healthcare system. And this is incredibly, no thank you, harmful when we don't allow people, if we let this to happen under their side of the house. We then tell you that it's incredibly harmful for people in, no thank you, in a lower tax bracket. Because whilst it might look like a carrot in the short run, that by letting people have a tax bracket, they'll be saving money by not paying for healthcare, in the long run, when people will need these services, because when people eventually will need healthcare, when people eventually will need education, they won't have a chance to opt back in. We tell you it's very harmful to hold a carrot out in the short run for these people, when it has very, very long-term harmful results. So for these reasons, and for the reasons that my first speakers presented you with, we are proud to oppose.
The thing about government services is a lot of the time people genuinely morally object to them and their provision. They genuinely disagree with what the state is doing, and under the status quo, the state uses its coercive power of the law to force people to pay for things that they don't just moderately disagree with or not particularly enjoy, but actively morally oppose. That makes those things morally complicit to a financial level in the activities of the state. And the most obvious example of this is abortion services provided out of public healthcare and hospitals, right? Because the line is that abortion is a private matter is a bit of a lie when you're forcing everyone around you to pay for that same healthcare system that provides those abortions. We think on either side of the house, people should, in democratic systems, have the right to tell, to say, their government is doing the wrong thing, and I will opt out of the service and your government service provision and get a discount back, or not be financially complicit in that activity based on that fact. And that will form the large portion of our extension in this debate. So what am I going to do? I'll start off with some rebuttal, and there's going to be two parts to my extension. I'll start by extending out, by explaining about the morality of service provision and why allowing people to opt out is really important. And then secondly, I'll talk about and do some extending in and talk about why we think this provides better service provision. But first, some line things of rebuttal. One, The opening up told us that people derive general benefit from things like an educated society and a society with healthcare. Yeah, and that's why people will still generally pay tax under our side of the house, right? People will not support the education system to some extent. They will, and they will roughly pay, and I'll take you in a second, for the general benefits they derive. What they will get back is the specific benefit they would have otherwise arrived from the system. That's why they will still pay some tax, but they will not pay as much tax as they otherwise would have.
Why are we required to remain and contribute to the society? Why can't we just leave for somewhere that we aren't morally opposed to?
I mean, so that's a bit of there's a circular problem there, right? In that you assume the state has the power to demand me I leave when the reason the state controls me in the first place. Obviously, in this debate, our extension is not people should be able to opt out of the state entirely, right? But there are specific instances where it's a nice thing to do, just let people not pay for services they disagree with. There's a bit more way in which they can use their wallet as an expressionary tool. I don't think people should be able to opt out of the entire existence of the state, nor is that a viable thing that people have the capacity to do, nor can a state let that happen. What a state can do is say, you don't have to provide or pay for every single service I benefit. There's a obviously scalable problem there in this debate. So, the second thing they wanted to say is that people will opt out of healthcare and they'll go, oops, I actually needed healthcare, and that'll be a problem. The way you opt out of healthcare, right, to be absolutely clear, the way you opt out of healthcare is by buying private health insurance. It's not even like that you have to buy it later. The way you would signal to the government that you are opting out of healthcare is by buying the private health insurance. The only way you can get the discount is if you buy the private health insurance, otherwise you'll be paying for public healthcare. So it doesn't even make sense in this debate. But also, why can't people just have to pay it back later if they want to opt back into the system or something of that nature? I'm sure the financial accountants at the state have a way to backtrack this and make it all work in the end. Then we got told there'll be less money in the system. This is a revenue neutral policy. Every decrease you get in revenue, you match with a decrease in cost, right? When I don't pay 20 grand to a system, but I also don't consume 20 grand from that system, the bottom line doesn't change. The rough idea of this policy is that the state will make as many savings as it will have a reduction in income. And I'll explain why in my extension, even if that's not true, that we would be okay with some of these services shrinking in small magnitudes if they became more streamlined and efficient. Something they're likely to do. But yeah, this is meant to be roughly a revenue neutral system. Fourthly, we got told there was this discussion about which is more efficient, the private versus the public. We don't have a position at closing up as to which is more efficient. We think sometimes the public system is more efficient. No, if the public system is more efficient, people will not opt out to the private system. So if it is true that governments are good in this debate and run things efficiently and do things well, there's a mechanism where which people just will use those services and not opt out. That's already dealt for. So, on to my extension. First part, morality service provision. Governments provide all sorts of services that people genuinely morally object to. I've already given you the example of abortion. This is also often true in education, the way the state goes about teaching people's kids. No, thank you. We think in this debate, it is often quite evil of the government to force those people to feel like they are financially complicit in those things that they genuinely morally abhor. I personally really hate Australia Post. I think it's the most evil economic thing in the world, and it needs to stop existing. It is a good thing, therefore, that I could get a discount by refusing to have letters sent to my house from a government-run monopoly that I object to, and that it has been quite corrupt recently. I think the same is true of all these other areas, right? We actually think it's quite horrible that we force people with really devout and strict religious beliefs or moral beliefs about abortion to be financially complicit in the having of abortions in Australia or in any other country in the world. It's actually quite a really horrible thing to do, those people. No, we're not saying they're right or wrong. It really doesn't matter in this debate. They just have personal ethical views that we think the state should, where possible, try to make room for. And that is the distinction between this and leaving your state, right? There is a massive problem scale between this and just upping and refusing to pay tax altogether. But where possible, we think the state should say, yeah, you shouldn't have to pay for these services if you genuinely disagree with them. I mean, that will often be what happens under our side of the house. But the second thing to note is it's actually much better that people can opt out, because it means they are more likely to allow those things to occur. People in the USA, one of the arguments they make about abortion and opposing Obamacare and stuff like that was that you had to pay for other people's abortions. That was one of their main arguments against providing a good healthcare system, was it meant you were being complicit in actions. If it's true they could just opt back out of that, if it's true that Obamacare didn't come with firms and businesses funding abortions, people might have been much more likely to support those. So you're actually more likely to allow people to have access to these controversial moral areas where they want them, because other people aren't being forced to pay for them. And no, you don't reduce the amount of service provision, because lots of people will be happy to pay for these things. There'll be plenty of space for that to exist in the first place. I think that's really good in this debate. The state was to be able to fund a public healthcare system that provides abortion, and people who really oppose will be able to opt out. I think that's really important in this debate, that we allow people to make that space And that also you're more likely to get these things occurring and less likely to have political opposition to these private decisions because other people aren't involved. Second thing, better services. Let's note two things in this debate. One, government services are often just straight up a waste of time. Like they're bad services, they literally shouldn't exist. It's often hard to shut down large government departments. There's often a huge time delay based on political realities between people realising that Australian Post is dumb and shouldn't exist because no one sends letters anymore, and like we can all live with sending emails and using Facebook Messenger. And there's a real disconnect between that and putting in all the work that is firing all the public service and government employees that work for Australia Post. And that's a real shame because people are literally right now voting with their wallet. No one is sending letters, but there is a massive time lag and delay between the state cutting that money. We think either outside the house we could just all opt out of Australia Post and the government would literally have no choice. They'd be like, oh, better shut this department down. But second thing to note here, governments often create sort of like perniciously subtle monopolies, right? Because if governments provide a mediocre service to you for free and you can't get a discount for opting out of that service, you don't have a huge incentive to go buy private, even when a private alternative might be viable. This is a really good example is like UPS, right? More people in countries where you can opt out choose to do things like UPS. But right now in Australia, we kind of say, Australia Post is okay at parcel delivery, I get it for free, I won't bother to opt out. So the government has basically forced UPS out of the market in a really mean and unfair way by using their powers of taxation. This rectifies that now, right? Because we can opt out and then you get a tax rate. This all means better service delivery to poor people, right? All of those things are really important for people who come from positions of poverty because efficient service delivery and those monopolies being shut down often matters the most. And that's what we're proud to stand.
There is an immense value in taxation, and I want to remind everyone in this debate what that value is. The value comes from two things. Redistribution of wealth, which we think is incredibly important to society, and the provision of public goods, which can never be provided by the private sector, because the private sector lacks the unique incentives of the government to provide those services. So, with those two big ideas and benefits of tax in mind, I'm going to go through rebuttal and then bring out my extension outside of this debate to look at the benefits of redistribution of wealth. Firstly, let's touch on the idea of the right to opt out. Well, we heard that the people have the right to opt out of a system because they do not benefit from the system or that they are forced to provide for something which they could otherwise get better results of. We say that's hugely problematic because everyone benefits from the provisions of public service the government provides. Now those are in two ways, either directly, where you're a person that actually gets clear benefits from things like welfare, from things like public health service, where you are engaged with those, no thank you, or more importantly, because this applies to everyone, you indirectly benefit a huge amount. And the problem with saying that you would still pay the degree of tax to which you indirectly benefit from this is that there is an incredible, huge barrier with quantifying the benefit that you receive from those people. We think it's ridiculous to suggest that you can somehow quantify the benefit I receive as my business to having a cohesive society that is well educated, that is healthy, that has a law-abiding society, because the benefit is infinite. My business would not work at all if there was not a society in which law and order existed and healthy people. Yes, please.
And this is why your business will still pay a large amount of business tax, Mond, to pay for those things in general.
If you believe that the businesses will still be paying large amounts of tax to compensate for the indirect benefits they receive from public services, then there is no benefit at all to opting out of this system. To whatever extent you minimise the amount of tax that people are paying, the amount of tax that they're getting back, then you minimise whatever benefits you bring out under your side of the house. We say this system is one that is self-defeating. Whatever benefits you say someone gains from gaining in the public sector, you minimise the benefits of the money that they get back. We also say under the right to opt out, we have a duty of care to provide a minimum standard of living to some people in society. We think it's not okay that if everyone who can afford to get other healthcare opts out of the healthcare system, that those who cannot pay any tax, are left without a functioning healthcare system. We do not think that is good enough. We think that we have a right to minimum standards based on our treatment as human rights. On the idea of conscientious objectors very quickly, we say sometimes the state is very willing to override the interests of people. For example, pacifists during the Vietnam War, or other wars more importantly, are a better example. We say that while some people might object to this, some instances we realise that the rights and interests of the state override the moral interests of the individual. For example, racists. We provide healthcare services uniquely, regardless of what race you are. Now, if someone says, because you are black, I do not want to be paying for a black person's healthcare, We would object to that. We would say that sometimes people get things wrong, and we would force those individuals to pay for these services anyway. That is why we think that their moral right to conscientiously object to certain services is pretty ridiculous in the vast majority of cases, because the kind of people that would be conscientiously objecting are those sort of extremists. On the idea of public versus private efficiency, very quickly, fewer people engaging in services in the public sector, that's problematic. What you are getting is fewer people who are being able to contribute to those services are engaging with them. So they proportionately contribute more to those public services than they benefit from. We would say that when those people opt out, the type of people that opt out of these systems are the ones that contribute the most to it. And all you will be left with, after everyone opts out to their perfect private utopia, is the people who cannot provide anything for these public services. And those are the ones that will result in lower quality services. That is when I asked a POI earlier, it makes sense that these services run at lower profit, at a lower budget overall, and that means those individuals suffer when they're engaging in those services. This system is not revenue neutral because it will be impossible to effectively quantify those harms that they benefit. On the idea of private sectors, very, very briefly as to why they're not always that great, we say that sometimes the public sector is advantageous for two big reasons. Firstly, economy of scale. We think there are some things like public healthcare which are going to be much better when an entire government runs them. Things like road services, while toll roads might exist in some small cases, they're never going to be as good as main services. So we think also that they lack the incentives of public sectors. Sometimes it is not economical to provide services to certain groups in societies. For example, congenially mentally disabled people. They will never be able to pay much money. The fact is, there is no profit incentive, which is the only incentive that differentiates private sectors from public sectors. That is not present to provide those services to those people. We think those people deserve services anyway under our side of the house. Okay, so onto my substantive, where I'll be extending out into this debate. I've got two big points that show huge benefit under our side of the house in keeping tax and even increasing tax. Firstly, the economic benefits of tax redistribution, and secondly, the social benefits of tax redistribution. On the economic benefits, while it might make sense to say that the less tax-rich people pay, the better off they are, the inverse is actually true, because you have to keep in mind the kind of environment in which these rich people exist in. They don't exist in a vacuum where all money directly goes to them. They function in a business society. When you have poor people who are not getting the tax money that they could be getting, they're an underutilised segment of society. They're a part of society that could be productive. They could be entrepreneurs. They could be providing beneficial services to the rich people who are paying lower taxes. When you increase the utility of a huge, huge part of society, which is those in the lower quartiles of economic, like socioeconomic status, they are grossly underused. We say those millions and millions of people could be much more better utilised to benefit society. We also say, in very simple terms, you need consumers if you're a rich person and you're producing your magnificent rich business. When poor people do not have the money to spend on your services, the rate of increasing your businesses is smaller. It might actually make sense to take some money away from yourself, give it to other people to invest in your business, which is a very rounded out way of actually boosting your business and artificially creating better progress. That's hugely beneficial for those people. Second idea in my substantive, why there is a social value in redistribution of wealth. We say at a very, very simple level, we support a minimum standard of living that all humans have by inherent fact that they have certain traits such as moral agency, embodiment, and personhood. Those things cannot be alienated, and we would protect those rights under the alternative of the private system, which does not cater to individuals not willing to pay for it. User pays fails so much in those instances. On the second subpoint under this area, we think there is a value in social cohesion when you have minimum disparity of wealth. You see riots, you see protests and opposition against people when there are huge disparities in wealth. We would not allow those sort of social cohesion harms. For all of those reasons, we were very proud to oppose.
As a team, we generally agree that redistribution is good, which is probably why, under our system, redistribution still exists. Under our system, it's pretty fundamental for everyone to understand that things like welfare exist, like the fundamental components of redistribution of wealth exist. We also pointed out to you at our member speech that people will still be paying some sort of tax under this system. All they will be doing is getting refunded from the government the amount that they have costed the system. And so that is why we tell you that redistribution still actually exists. But what we actually tell you, further than that, even if it didn't, a more effective form of redistribution
redistribution that they haven't responded to yet is people being able to pay for their own services and get themselves and increase their social mobility by getting into better services. We tell you that if you are someone who is just on the border of being able to afford private health insurance or private education for your children, and taking these tax breaks mean that you now can afford that, we tell you that getting yourself into that better system is a much more effective form of redistribution than anything the government does.
Point.
3 questions. Does an individual have a right to opt out? Does this make services better? And what's on the public services, and does this make private services better? On to this first question of do people have the right to opt out? We've heard 3 consistent themes down the government bench. Firstly, that people benefit from services they don't use and therefore should have to pay for them. Our response to that is consistent with our members and still hasn't been responded to, is that people will still be paying tax under our service.
Point.
The second question is people do not have the ability to decide to opt out of services in some circumstances. They also haven't been able to respond to our response to this, which was the instances where you opt out of the service, you also have to pay for those services. You probably know you have to have private health insurance. So it's not like you're going to one day call up for an ambulance and no one's going to show up because you've opted out of the service. It means, like the opening half wanted to characterise it, that's just not going to happen because we tell you that people have to have private health insurance. But also we tell you that it's better for people to be able to make this decision than the government. If anyone's going to make this decision, an individual who has an understanding of their life does a better job than the government. We then heard the response from the member of the government that interests of the state override interests of the individuals. And this brings me on to the point that actually won this point, and that's our extension that we brought you at member. So we tell you that it was awful for the government to ever force individuals to pay for services that they find morally reprehensible. The only response they were able to give you is the interest of state overrides interest of individuals, which is why we tell you that the state will still be providing these services. Abortions will still be able to be gotten by people. All we're telling you is that the individuals who live their lives in the torture of knowing that a service that they think is morally reprehensible, a service that they fundamentally disagree with, I'll take you in a moment, is being paid for by their money, we tell you that these people can get out of the service, yes.
What is the moral link between paying money into the government general revenue and the government then choosing to provide a service democratically?
We tell you that the service is that you are paying for that service, right? Like we tell you that when you are being paid to be able to access a service that you find morally reprehensible and you will never use, like we think that that's a pretty strong link, right? Like we tell you that when you are giving money and you are paying for that service, that's a pretty watertight link. On to this second question of do we make services better? Under the public system. We've heard this analysis down their bench that because there is less money going into these services, therefore these services will get worse. The thing that you have to understand though is that the costs of these services also go down. So yes, there will be a drop in revenue. But we're telling you that because there are less people who are using the service, it means that there will be less costs. We tell you at some point when you have more people using a service, you have to increase infrastructure. You have to add another level on a hospital. You have to open another GP. We tell you when you reduce these costs, when you reduce the number of people in a service, you reduce these costs. They then wanted to tell us that there will be less specialisation and less incentive for the government to give better services. What we tell you though is that this actually provides the system with incentives to cater for the specific people who are using these services. We tell you that when you no longer have to provide GPs for people in wealthy suburbs, what you have to do then is you have the money now to specialise and promote the services diabetes centres for people in rural communities. We tell you that when you have a very targeted groups of people who are using your services, you are able to better allocate the funds to use these. But what actually won this point was our extension and the fact that we actually get rid of services that aren't useful at all, and this money can then be redistributed back into these systems. We tell you at the point at which it's going to take years for us to get rid of fundamental systems that are clogging up the system and clogging out our money. We tell you that the best way to redistribute this wealth is by getting rid of these services and allowing people to vote by getting tax refunds. We told you that if we got rid of Australia Post, if we got rid of the billions of dollars that it loses every year, we might be able to create better systems and the government would be able to do that. On to this third question of how does this improve the private system? And I'm also, yes. They told us that three main things.
They told us that private systems have bad incentives and they never have the incentive to pay for services that people don't use. What we tell you though, is that's why the state will still provide these services, right? Like we do agree that in some instances, like there is not an incentive, and that is why the government will provide these services. We're not getting rid of government services. All we're saying is if you don't use them, you can opt out of those services.
Constipation.
No, thank you. They then wanted to tell us at their extension at member that redistribution is good, redistribution lowers cohesion, redistribution, as I dealt with in my introduction, we told you that the more effective form of redistribution is people being able to opt out of services and get better themselves by opting into the private system. What we also tell you will happen is because more people are using the private system, it will become more competitive and is likely to become more accessible and become a more compelling cycle. But what we told you at extension that actually won this point was that it shuts out the monopolies that are formed and allows for cheaper services to be provided to people from low SES backgrounds, because it means when you have more competition, when the government isn't shutting out innovation, it actually allows for people to be able to access more services and have more options and better quality services provided for them. So for those three reasons, we are proud to propose.
We were just questioned about how services would have less money attributed to them if we allowed this policy. Let me to understand now how averages work in this debate. The people who are less likely, both sides agree, to access the services of government are rich people because they are able to fund better services for themselves. At the moment, because of our progressive taxation system, rich people pay more money than they get back in services. There is not a one-to-one equivalence. Poor people pay less money than they receive back in services. That's the way the progressive taxation system works. So, if we take the proportion of money for the rich people out of the system, what you're doing is taking more money out of the system, the most money that is paid into that system. When you take the larger amounts out of a pool of money, the average per person goes down. That is what we've been talking about throughout this debate. That means per person there is less funding for these services, and it means the quality of these services must therefore necessarily go down for the poorest people. No, thank you. This is looking past the fact that having fewer people involved in services reduces the scale and the economies that come with that. And also, as the closing government wanted to claim there, the most expensive services are still going to be funded by government, to regional communities, to remote communities, those that cost the absolute highest amount for providing a base level of service. But now with a reduced amount of funding, no thank you, funding that would otherwise have been subsidised by the richest people who are no longer engaged in providing funds for these particular systems. That is why there is lower funding, that is why the quality of services for particularly poor people are reduced in this debate. Okay, first point in response after that then. Why people are not morally complicit simply because they pay taxes in our democracy. I've already given one response and a point of information to this, and that was people are currently able to opt out of the system, and it's not as hard as the government member wanted to make it seem. People can leave Australia if they have a moral objection to what is being done in our country. But it seems like their moral objections at this moment aren't strong enough for them to actually leave Australia. So it doesn't seem like it's too much of a problem for them at the moment, if they are, in their own minds at least, contributing to the payment, say, for abortions. But secondly, my response to this is that there is actually no moral link. Paying money into a government revenue fund does not mean you support all of the services that the government then pays for. No, thank you. There's no 32 cents of my income per year that goes towards abortion payments in a particular hospital. I pay an amount to the government, no thank you, and then the democratic process decides what that government spends the money on. I am not directly paying for any service here. Even if, no thank you Kirkby, even if I was to remove that 32 cents from my payment to the government, how can you confirm for me that some of my dollars aren't still being used for these programs? The only way you can be not morally complicit, if we buy into their characterisation, no thank you, is to pay no tax in this system at all, something that they're not willing to support in this debate. But, looking past even that,
What we say, no thank you, is that engaging in the Australian system of democracy means that you buy into everything that system does, whether or not you agree with it. You agree to support that through your taxation. That was what our extension brought you as well. And this isn't many people. It's a few fundamental Christians, say, on the fringes of our society, for whom we are not willing to sacrifice the services that we provide to poor people in the country at the moment, which is the outcome of this policy. Looking to this second idea then that was brought in extension about us being able to individually come together and shut down government services that we don't like. Well, first response to this, individuals aren't particularly good at knowing what government services are valuable to society, and so we need look no further than the government member's own material on this. Just because the government member doesn't often send mail in the post doesn't mean there isn't a huge amount of businesses, of courts, of individuals that rely upon this system in Australia at the moment. If you live in a regional community, you're never going to get a UPS or a FedEx truck driving 700 kilometres to your front door. No, you need a national body like Australia Post to exist so that you could possibly afford your shopping over the internet or any other kind of mail to come to you in those places. This isn't a service that the community as a whole is willing to opt out of, but what you get is a lot of irrational decisions on the individual basis, contributing to the loss of something that is absolutely necessary in our society. A secondary area then would be welfare, which the government, closing government brought up as well. There is perhaps no single area of government that people object to more than paying welfare to those they see as not deserving it, and there is no reason those who don't receive welfare at the moment would not opt out of that. Yeah.
The state uses a taxation code as a way for it to enshrine inefficient, poorly run monopolies, because why would you opt out of a service if the state's basically forcing you to pay for it either way?
It's not an inefficient monopoly though. Government services have been designed to, at the best way possible, bring in this kind of service. And you see that through the kinds of political accountability models that currently exist. When a service is not performing well, when it's a government service, you see that represented, no thank you, in the media. Australia Post at the moment is being dragged over the coals. It's having to reinvent its business because it's being held accountable to the democracy. That is the kind of way we want these things to develop, and it's the kind of way that means it's more focused on parcel delivery. It's changing its policies so people have to pay more for stamps, have to choose a 2-weekly delivery model, for instance. It is modernising because of the pressures that are being placed upon it at the moment. So there is no reason why this simply cannot continue to happen without having this penalty for the poorest in society that comes with allowing people to opt out. Secondly then, about why these services are particularly made worse. I've already explained why it is the poorest people and the regional people and so on that are most affected under this model. But why is the profit motive that the government wanted to hang their hat on not enough to ensure that every person has access to great services? Well, what does the profit motive do? It makes you want to make money. It doesn't make you want to provide good services. There might be some correlation between providing a good service and having people pay for it, but more often it is far easier for these companies to engage in lobbying, to engage in marketing, to make people believe they want their services, rather than actually providing a better service. Look to a government contractor, for instance, Serco. It's the reason that people in a hospital at the moment are being delivered food that they're allergic to. It's the reason we're abusing asylum seekers. It's the reason our American prisons currently are being run for profit and bringing more and more people in through the lobbying to the government. What you get when you privatise these kinds of services is that profit motive used in a way that is simply destructive and does not provide services to the poorest. If the rich stop paying tax for services, everyone else loses out, and that is why I'm happy to oppose.
Congratulations everyone on what I thought was a very high quality debate. I gave this debate the first to the closing government, the second position to the opening opposition, the third to the closing opposition, and the fourth to the opening government in what's known as a short diagonal decision, which some of your coaches will explain a bit more about later. The reason why I gave the first to the closing government over the opening opposition is I felt they had more important material and were effectively able to rebut the idea that this will result in worse public services. I think that their extension was unique, and I thought it was very interesting, and I thought the idea that people in society could use their relationship with public services to change public services by opting out of them en masse provided a very, very good set of benefits which were unique to the closing government, and I don't think much of their material was very clearly refuted. The reason why I gave the second to the opening opposition was I felt that they did a very good job in setting up the opposition's case, specifically saying why this is likely to result in richer people opting out of the system and why that will result in worse health outcomes and worse public services for poorer people who cannot opt into those richer systems. I thought they also had a lot of very good material about how this would necessarily be principally justified, and whilst I felt that a lot of this material was superseded by closing government's rebuttal, I felt that it was still strong material. The reason why I gave the closing government third the closing opposition third behind the opening opposition was I felt that whilst a lot of their material was also very good, I felt that largely their extension points were somewhat derivative of the stuff which had come out at opening opposition. Because of that, the two unique points they raised were about how redistribution works and how it's good for the economy, which whilst I felt stood in this debate, were not nearly as important as opening's material about how this is going to reduce the impact on public services. Whilst I also thought they had the best defence of how this will make public services worse, that came out a bit too late at opposition whip, and obviously in debating we can't take into account as much stuff which comes out at the whip speech because opposition whip doesn't have anyone after them to rebut those points. The reason why I gave the force to the opening government was because I felt that they had a very weird idea of how this would actually impact public services. I felt they didn't very clearly explain their model, and I felt that at times they were quite confused in what the actual impacts of their model would be. A lot of their material was quite assertive, and whilst I felt it wasn't a bad opening government, I felt that a lot of their material fell out throughout the rest of the debate, sort of leaving them out isolated from the debate, and they weren't able to bring their stuff back in. Overall though, it was a very high quality debate, and good luck to the competitors in the 2015 WADL DP competition.